Wellness Wednesdays on The Takeover, brought to you by station sponsor Kelli K Naturopath. Book your free intro call today at kellik.com.au.
Yes, Kelli K Naturopath joins us for Wellness Wednesdays. Kelli, how are you?
I'm good, thank you. Warm, quite warm.
It is good. Warm. Yeah. Do you love the summer weather, don't you? I think I remember when I asked summer or winter, you said summer. So
yes, definitely.
Is there a limit though for you? Like, is it like 38, 39 degrees, or do you just like the hotter the better?
Look, if so long as I'm not out in the direct sun, anything up to 35, 36 is quite nice for me. Yeah. And then it starts after that, it starts to get a bit much,
That's fair enough. Tonight we are discussing for Wellness Wednesday, it's only the second one of the year. We only just launched back into it a couple of weeks ago. Tonight we are answering a question about naturopaths. What do naturopaths do? So that's the first question. But then also how or what to look out for when choosing a naturopath and searching for someone to see for, advice and for support. So to get us started, Kelli, the first question is, what does a naturopath do?
Yeah, well, a naturopath is a complementary health practitioner who helps people improve their health and quality of life, and also looks to reduce the risk of developing illnesses as well by using strategies and remedies that are as gentle and close to nature as possible. So, and also educating and empowering people to take charge of their own health and make good choices for themselves as well. So, and a big part of what a naturopath does or the focus of a naturopath is about treating the whole person. So we take a very holistic approach, taking into account not just what's going on in their body, but also what's the mental health like, what's going on in their life, stress, social support networks, finances, all of that as well. So a holistic approach, and also an individualized approach. So, valuing people's unique story. So I might have 2 or 3 people with exactly the same symptoms or diagnoses come in, but I'm unlikely to treat them exactly the same way each time. So,
So I imagine
that's sort of in a nutshell.
Yeah, I imagine that working as a naturopath, no 2 days are ever the same, because even when you're seeing the same client again, there would be, new complexities and it would be a very interesting job and a very rewarding job, I'm sure. I mean, when I was younger, it was one of the things that I had on my list. I was like, I'm going to do this, and I want to be a naturopath, and I want to go into nutrition, and I'm very passionate about it. I obviously didn't go down that path, but I think that it's one of those, jobs that would just be so rewarding and so satisfying. And I used to describe it to people, and I know this is probably not the correct way to describe what a naturopath does, but I would used to say it's kind of like being a doctor, but someone who specializes in natural medicine. Would you say that's kind of similar?
Yeah, so not a medical doctor in Western terms, but naturopathy in itself is a system of medicine which has its roots in sort of a traditional philosophy and understanding. So those things I just mentioned, being holistic, treating the whole person, individualized, and empowering people. And modern naturopaths are trained in health sciences. So we don't have a medical degree, but we're trained in health sciences and also, nutrition and nutritional biochemistry and herbal medicine, and looking at it both from a modern scientific point of view and also a traditional point of view, and blending the two. Yeah. So, and you're right, there is a lot of variety. And it is very rewarding as well to be able to, I suppose, dig a bit deeper and help people support their health by getting really to that cellular level and going, well, what's going on and how can we fix that? Take an upstream approach and try and support you so you have less symptoms. And, So I guess that's the one. Another very important part of, naturopathic medicine that I didn't say is that trying to get to the underlying cause and trying to not just do symptomatic treatment, although that is important as well, and we do that, but also trying to dig a bit deeper and saying what's driving this, what's causing it, and trying to address those underlying things.
Yeah, and I think the real holistic approach is what makes naturopaths very different from traditional medicine in the West. So, you know, I think that obviously has a place as well. And we're not saying don't go to your GP or don't see a medical doctor. That's not what we're saying, but they're slightly different. So, I guess they're different,
but they're also complementary. So
yeah.
It's a complementary medicine. So it's to complement what, you know, what else you're doing.
Yeah.
And almost 100% of my clients are also seeing their GP or their specialists, or, you know, and we're working around that and working alongside that to support them.
Perfect. Well, let's take a quick break. When we come back, we will look at what your tips are for actually finding a naturopath to see, you know, some of the different things to look out for, what it's like to make an appointment with a naturopath, what it looks like to have the appointment, that sort of thing. So don't go anywhere. We're in the middle of Wellness Wednesday on Life FM. You're with Maz for the takeover, and also joined by Kelli K Naturopath. Kelli, how are you?
I'm doing very well, thank you.
Thank you so much for sticking around for Wellness Wednesday. Tonight we are looking at what a naturopath does. That is the topic for the evening. We're discussing what a naturopath does, what makes, I guess, naturopaths different from other healthcare professionals, which we've basically just talked about. But right now we want to discuss what it actually looks like to have a naturopath appointment.
Yeah. So, the first thing to understand is that in Australia, the title naturopath is not protected, which means anyone can call themselves a naturopath. So to ensure that the person that you're going to see, first and foremost, has adequate training, the first point of call is to check that they're registered with one of the professional bodies, professional associations. So once you've sorted that out, then most practitioners nowadays will either have online booking, or you call them like you would any other clinic to make a time. Everyone might be a little bit different, but that's how I work. Some people with me, they might have an introductory phone appointment first. So they can have a chat with me, ask any questions, and, you know, make sure that I'm the right person for them. And then once the appointment's booked, usually they will get sent a confirmation email, and there'll be an online intake form to fill out. And I may request, if they've had any blood tests done recently or any investigations, that they bring those reports with them to their appointment so I can take a look at those. And then once it's time for the appointment, if it's you know, they arrive at the clinic. If it's a face-to-face appointment. If it's Zoom, obviously it's a bit different. But yeah, they arrive at the clinic. Everything's private and confidential. So once we're in the clinic room, the first appointment is usually a longer appointment, and this is primarily an assessment appointment. So we're very thorough, us naturopaths. We like to get into the nitty-gritty, as I said. So there's a lot of questions. We'll go into, you know, your current concerns and symptoms. We'll ask about medical history. We might do some physical examinations, such as taking blood pressure. And we'll ask about your diet, lifestyle, any medications or supplements that you might be taking. And from there, it's about working out a plan together. So usually I might just maybe ask if there's some further investigations to be had. I might refer for those, or just get them started doing a couple of small things at home. And then I'd put together a treatment plan. And so treatments might involve some or all of the following. So it might be it would be general diet support, but it might also be using specific therapeutic diets, or using specific foods in the diet as therapeutic foods. There might be herbal medicines, which might be in the form of teas or tablets or liquids, or nutritional supplements if I think it might benefit that person, or if there are deficiencies that have popped up when we did the assessment. And then looking at lifestyle advice. So this would be things like, movement or sleep hygiene and those types of strategies, or not so much what to eat, but some strategies around when to eat, or, more about the habits around food, not so much the food itself.
Okay.
those are the types of treatments that we would present for the person. And then from there, there would be some follow-up appointments. And this is just to check in to help patients with any challenges they might be having, troubleshooting with them, encouraging them and, spurring them on as well, and also making any changes, because people should be getting some improvements and, things might be changing for them. So we want to be able to move with that. And so treatment will evolve over time. Yeah. As well. So, hopefully that answered your question.
Definitely does. It does. And you've been very comprehensive in your response, and I appreciate that there is a lot that goes into those initial assessments and things. But if anyone is interested, it's not a scary process. You can find lots of naturopaths across Adelaide online, on Google. Making sure that they are accredited is very important, as you say, Kelli. We are just running out of time, so we will have to wrap it up. But thank you so much for joining us on Zoom tonight to talk about naturopaths, what you guys do, the whole philosophy, I guess, of being a naturopath and what it means for people in their health and well-being. So thank you so much, Kelli. We'll catch up with you in a fortnight. And we're actually going to be talking about iron deficiency next time, which I am super keen to learn more about. So we will do that then. But also remember, you can always text in your questions as well. 0413 90 1079. Kelli K, Naturopath, thank you so much.